Rates of syphilis and gonorrhea are through the roof. The high rates of syphilis and gonorrhea diagnoses in England have sparked concern. Both STIs have increased by more than 20% in the past year, and cases of syphilis are at their highest level for nearly 70 years, new figures show. Public Health England, which published the figures, called for strengthened local and national services for the prevention and treatment of STIs. A total of 7,137 new diagnoses of syphilis were made in 2017, a jump of 20% on the previous year. The largest annual number of reported cases since 1949. Diagnoses were most common among 25 to 34-year-olds, who accounted for 33% of all cases, followed by 35 to 44-year-olds. Nearly 78% of diagnoses were in men who have sex with men. While the overall number of new STI diagnoses in 2017 was broadly unchanged year on year, there was also a 22% increase in cases of gonorrhea, a trend Public Health England described as concerning. In March 2018, the first case was detected in the UK of a strain of gonorrhea highly resistant to the two types of antibiotics commonly used to treat the infection. The case was linked to travel to Southeast Asia, but Public Health England has reminded GPs to refer all suspected cases of gonorrhea to Specialist Sexual Health Services, SHS. Total SHS attendances across England increased 3% between 2016 and 2017, from 3.2 million to 3.3 million. Over the past 5 years, attendances have jumped 13%. Councillor Izzy Seckham, chairwoman of the Local Government Association's Community Wellbeing Board, said the rise in attendances was placing a significant strain on council resources. She said, "There is no time for complacency. Unless greater recognition and funding is given to councils to invest in prevention services, a reversal in the encouraging and continuing fall in STIs is now a real risk. Health inequalities will remain and councils may be unable to respond effectively to unforeseen outbreaks. Government must reverse cuts to councils' public health grants because we cannot tackle this by stretching services even thinner," she added. Figures also showed a drop of 8% in the number of tests for chlamydia. Public Health England noted that most of this decrease had taken place in sexual and reproductive health services, where chlamydia testing has fallen by 61% since 2015, a trend likely reflecting the reduction in service provision. It recommended that local authorities need to enable young women to be tested for chlamydia when they access contraceptive services, and stressed the importance of statutory, high-quality relationship and sex education in secondary schools. Jeremy Corbyn attacked up for telling Westminster to stay out of abortion row. Mother stabbed to death at her London home was pregnant with her third child. Paedophile kidnapped child from park after being released on bail. Dr. Gwenda Hughes, consultant scientist and head of the STI section at Public Health England, said, "Sexually transmitted infections pose serious consequences to health, both your own and that of your current and future sexual partners. The impact of STIs can be considerable, with some causing infertility, pelvic inflammatory disease and harm to unborn babies. Consistent and correct condom use with new and casual partners is the best defense against STIs, and, if you are at risk, regular checkups are essential to enable early diagnosis and treatment." Fire Brigade hits back at criticism of stay put advice to Grenfell resident. Salad cream is going to have a totally different name for first time in 104 years. Man con granddad out of life savings to pay for girlfriend's breast enlargement.